talk about the jaw and TMJ. That's what commonly just referred to that the TMJ, the
Right.
bite basically,
Right.
and why that is such a high producer of substance P, and then the reason why, as you've just laid out, why substance P is such a huge problem. So if you're not regulating substance P, you could have all these issues. Autism would be, vitiligo, seizures, all these things. It's a mitochondrial disorder at the end of the day.
Right.
So talk about, the bite and how you kind of figured that
Right.
out.
So, as I was developing my theories and developing, learning to treat patients, there was a big question in my mind: is there a range we can treat people to, or is there a precise spot that you should treat people to? And when you decompress the joint, so the problem these days is most humans are born with the jaw too far back.
Mm-hmm.
All primitive humans bit tip to tip, end on end. And these days we all have varying degrees of overbites, and a few of us have underbites. But the overbites are usually dysfunctional. There's biomechanical reasons why we need, must, should, and do better biting tip to tip. The muscles attached to our lower jaw to be strongest whenever they have to service the furthest point from your joint, that's when you're biting out tip to tip. So muscles attached to be strongest, that's when they're relaxed, when you're tip to tip. So when you wade into the system and are changing bites and you're trying to find out where those muscles are most relaxed, it's almost always when people are end on end. What like primitive humans used to be. There's a biomechanical functional unit here that dictates that we need to be biting tip to tip. And so these days, as humans' jaws go off, it starts, your temporalis muscle is the one that pulls your jaw back, so it becomes hyperactive. It's tonically contracted and overstimulated. And this sensory zone here, from here to here and ear to ear, your trigeminal nerve, has 100 times more dense pain fibers than any other part of your body. So when this nerve becomes hyperactive, it triggers your substance P levels to start rising in your body. Your masseter muscle, your cheek muscle here, is the only muscle in the body when irritated will cause a spreading cascade of elevated substance P.
Wow.
So it goes from the trigeminal to the ganglion to the brain and down the spinal cord. So like in fibromyalgia, the substance P levels are 3 to 5 times normal in the spinal fluid. And then people just hurt all over. And the physicians say they can't find what's wrong because they're not really looking at the research. And the fact that people haven't heard of substance P is because there's no pharmaceutical remedy.
Right.
And so since there's no pharmacy, nobody goes there, nobody thinks about it, nobody talks about it because there's nothing they know to do with it.